Some mental health professionals are warning Canadians about an increase in cannabis-induced psychosis. They say that although the drug is now legal, that doesn't necessarily mean it's risk-free. Let's bring in Chris Somerville. He's Chief Executive of the Schizophrenia Society of Canada, joining me today from Winnipeg. Hi, Chris.
Hello.
So before we alarm people, now that marijuana is legal, can you tell me a bit about the numbers? How much has there been a spike in people reporting cannabis-related psychosis?
Well, now that it's legal to talk about it, or rather to use it, people are much freer to talk about the use. And so the schizophrenia societies across Canada are experiencing more people talking about use. And even though they don't have psychosis or schizophrenia, I mean, people come to us for other reasons as well around depression and anxiety. And the main point, I think, is that no one should think that cannabis is harmless or benign. I mean, there are warnings for women who are breastfeeding, who are pregnant. There are warnings about respiratory problems. So when we come to the brain, a lot of people think that this is some sort of conspiracy by the government or the society to keep people from using cannabis. What we're all about is informing people about safe use, reducing harm, and be informed about the risks that can be had with use of cannabis.
Okay, so we don't have a lot of time, so I want to get right to the nuts and bolts. What qualifies as a psychotic episode, and who's most at risk?
The person most at risk for experiencing hallucinations and delusions in which interferes their ability to understand reality are those under the age of 25, because the brain is still developing between conception and 25, those who use high potency cannabis, those who use daily are at a greater risk, and those who have a family history of mental illness have a 5 to 7-fold greater increase. 40% of all psychosis is associated with cannabis.
Okay, some good stats there. I appreciate that. But to hear what you're saying, or to delve into it, a psychotic episode is more likely to happen if you are predisposed to some kind of mental illness already?
That's not necessarily true.
Okay.
See, that's the great assumption that people think, is that you will automatically have schizophrenia regardless of whether or not you use cannabis or not. Schizophrenia is a much more complex illness than we ever thought. It is a number of illnesses, and it's not just one genetic factor. We know that people who live in impoverished states have higher rates of schizophrenia. So environmental factors are part of the development of schizophrenia, and so are hallucinogenic drugs.
Just a few seconds left then to tell me, what's the messaging you're trying to get out today, Chris?
Well, before you use, learn all you can about safe use. Try to avoid use until you're in your late teens. Avoid high potency, and certainly do not use daily, because those who use daily have a 2 to 3-fold greater risk of developing psychosis.
Appreciate your time. Thanks so much.
You're welcome.
Chris Somerville joining me today from Winnipeg.